Let's again look at the heart in different ways. You may have heard something about a QTC complex on an EKG. So, what's an EKG? An EKG is just a little electric picture of the heart for a few seconds. We take these electrical wires that does not hurt at all, and we put them at different spots along our chest, and we measure electrical activity that goes through these wires as our heart is beating. And there's lots of information we could get from this electrical picture. We could see if the heart rate is too fast or too slow. We could even see if someone had a heart attack and if part of the tissue of the heart has died. We see how electricity runs through that tissue, and it could tell us, hey, someone had a heart attack in the past. Well, one of the things we look at in all aspects of starvation or unhealthy eating is something called a QTC complex on an EKG, on this electrical picture of the heart. And this represents the time it takes from when the heart beats to getting ready for the next beat. And that represents the QTC complex. We know if the QTC complex is more than 450 milliseconds, it puts someone at a greater risk for developing abnormal electrical activity. And that then could lead to an arrhythmia, an abnormal electrical status of the heart, where again, sometimes the top part of the heart and the bottom of the part of the heart beat independently, and that could cause a blood clot, and it could cause significant medical concerns and even death with one's unhealthy eating patterns. So what we want to be careful of is to make sure the QTC complex is monitored. What causes an elevated QTC? We used to think it was starvation in and of itself, but that's not accurate. What causes the abnormal QTC are often medications that your doctor will prescribe. So for instance, if you're on an SSRI, a selective serotonin reuptake inhibitor, that can cause a prolonged QTC complex, especially if we're at higher doses of these medications. Or if you're on medications that help with nausea. So a common nausea med is Zofran, and we know that Zofran can contribute to an abnormal QTC complex. There's other conditions also that could contribute to this. The worry is that if someone's in a starved state, their heart is already weakened, and we want to make sure we do everything we can to be protective of the heart. And so if we're giving medications to a weakened heart, that could also cause some abnormal electrical activity, this would be of concern. The other thing that could happen with starvation with the heart is that mitral valve, that's the valve that separates the left atrium, the left upper part of the heart, to the left ventricle, the left bottom part of the heart. We have this valve that separates these chambers. And this valve is very important because when the ventricle contracts, the left lower chamber of the heart, to push oxygenated blood out the aorta, we want this mitral valve to stay shut so blood doesn't go backwards into the atrium, the upper left chamber of the heart, and then potentially into the lungs. So this mitral valve, we need it to function where when the atrium contracts, it opens up to push blood into the left ventricle. When the ventricle contracts, this mitral valve is supposed to stay shut. In starvation, what we see is the mitral valve doesn't work as well. The mitral valve is connected to the heart muscle by little muscles. And these muscles in starvation start to atrophy. So that means that the mitral valve doesn't stay completely shut. And so when the left ventricle contracts and the valve's supposed to stay shut, if the valve's not working as well, sometimes blood could go backwards into the atrium and potentially into the lungs. The example I'd give with this is that if you ever took a plastic water bottle, now these new water bottles don't do this as much, but if you took an older water bottle and if you fill it up and you put the lid on, you turn over the cup, water does not leak out. But if you've taken that water bottle, which I have done, and you put it in a dishwasher and the heat sort of melts the plastic just a little bit, now you fill up the cup, the water bottle with water and put the lid on, and now you turn over the cup and you may see a little bit of water leaking out. That's because there's not a tight seal anymore between the lid and the water bottle. Same thing with the mitral valve. If these muscles that attach to the valve, to the heart, start to atrophy, the valve doesn't line up exactly right, and you get a little bit of an overlap, and you don't secure a tight seal so that fluid, the blood could go backwards. When the ventricle contracts, the valve doesn't stay a tight seal, so fluid goes backwards into the left atrium and then potentially into the lungs. This is what we call mitral valve prolapse. Now, females are more prone to this in general, but if you're in a starved state, this could occur even more significantly. So how do we know if someone has mitral valve prolapse? Well, one simple thing is that when your doctor listens to your heart, again, when you listen to that lub dub, the atrium contracting, the lub pushing blood into the ventricle contracting the dub, instead of getting lub dub, what we hear is lub dub sh, lub dub sh. The sh sound is the blood going backwards upstream from the ventricle to the atrium, sort of like salmon fighting its way upstream. That's what the blood does when the ventricle contracts. Not all of it goes out the aorta, some of it goes through the mitral valve back into the atrium, and that's called mitral valve prolapse. So in starvation state, you're much more prone to getting mitral valve prolapse. That could be controlled by medications if it's not significant. However, if it's more significant, it causes more concerns. Sometimes even surgical procedures need to be done. Let's go back to the GI system. The longer one's in starvation, the more concerns we have with the GI system. And that's because the muscles that go along the tube of the intestine start to weaken more. So one thing that happens is that we get more chronic constipation. It's very difficult to move stool or food products down the intestine because these muscles atrophy, these longitudinal muscles. And so normally when we get food in the small intestine, again, the intestine expands and then these muscles expand, then they contract and they cause peristalsis. In starvation, that's very slow. The longer you have starvation, the more that is pronounced. And sometimes you even have to see a GI doctor to get on some special medications. There's some unique medications that could really help with this chronic constipation. We give meds like Miralax powder, which is a medication that when you take, it expands, it goes into small intestine, it attracts water, so you have to have a lot of water, and it does expand the intestine and tries to help those longitudinal muscles contract and push stool down. But there's other meds, one of them being Linzess, and we can talk more about this in other chapters of the book that could be helpful. Some of the other medical concerns GI-wise with starvation is that if you look at the small intestine, part of it travels between the spinal cord, the spinal column, the vertebrae, which are bones, and the superior mesenteric artery. This is an artery that comes off of the abdominal aorta. So you have this superior mesenteric artery, you have your spinal cord, your vertebrae, and part of the small intestine goes in between the two. Normally, there's fat pads that are on the small intestine that keep it open so that it could stay open between the superior mesenteric artery and the vertebrae so that the tube stays patent or open. In starvation, what happens is that these fat pads that protect the small intestine start to shrink because we're losing fat in the fat pads, and the superior mesenteric artery starts to push more against the intestine, and so we get a smaller space for the intestine, the opening, and it could even cause like a bowel obstruction, or feels like a bowel obstruction, like food cannot move through the small intestine. And so someone will say they have significant pain when they're eating, and this could be because the small intestine gets squeezed so much that it's hard to move, food so down the intestine. So what do? We get like a special x-ray looking at that part of the body, looking at the small intestine and the superior mesenteric artery, or you can get an MRI and take a look at what's going on. But that's a possibility, and that could cause acute pain from one's starvation. We also mentioned that in starvation, what could happen is the liver, which stores glucose and glycogen and also produces glucose, gets affected more and more. And the liver starts to atrophy as well. One of the things we see are liver enzymes. Every organ in the body produces its own intrinsic chemical. We sometimes call them enzymes. So like if I had chest discomfort and I went to the emergency room, the doctors would order cardiac chemicals or cardiac enzymes. If they're elevated, it's one sign that the heart muscle is struggling and I may be having a heart attack. The same thing with the liver. The liver produces liver enzymes or chemicals. And we know in starvation, these enzymes become elevated, and that's a sign that the liver is struggling. The liver is so important for so many different reasons, but in part, it helps with our digestion by producing certain enzymes. So we see liver enzymes becoming elevated in starvation. What we have to be careful is liver enzymes could be elevated in refeeding as well, like when we stress the liver by starting to refeed. If we see that there's fat in the liver, a fatty liver, this is a sign more of refeeding versus starvation, and it's just a sign that we have to go a little slower with our refeeding. But the liver does become affected as well. And there's different medications that could help the GI system function with some of these concerns. Okay, let's take a look at starvation. Even if we do longer periods of starvation, what could start to happen? So one thing that could happen is that the brain, the nervous system starts to become affected. And what we know is that if we take MRI images of the brain in starvation, in severe starvation, the actual cortex of the brain starts to shrink. The sulci, the spaces between the lobes of the brain and the cortex, the main part of the brain, start to become more pronounced, showing that the brain is shrinking. The ventricles, the spaces in the brain that store cerebrospinal fluid and where cerebrospinal fluid is produced, they start to become enlarged, showing again that brain matter starts to atrophy or decrease in size. So what does this mean? This really means that if you're starving yourselves over years, your brain starts to look like it's aged dramatically. And so sometimes we'll see somebody in their 30s or 40s looking like they have a brain of a 70-year-old or 80-year-old. There's atrophy of the brain. The brain is the one organ that is most difficult to repair with tissue. There's some evidence, some data that certain medications and certain treatments can help the brain produce some neurochemistry, some proteins, but in general the brain is very slow to start to reproduce cells. And so this is a major concern with the brain. It's more difficult to get pregnant the more we disrupt one's menses with eating disorders. Eating disorder, people that have starved absolutely could get pregnant. So we see that quite often, especially as they start to replenish their body's needs, and we see hormones start to rebalance. But there are higher infertility rates if someone has disrupted their menses over many times. So that's just something to think about. If you're starving yourself and you are pregnant, we always hear that the baby gets what it needs before the mother gets what her needs are. And this is most likely true. So what we often see is that babies are often born premature because of not getting in enough nutrition. And if you're born premature, there's just a greater chance of medical concerns for the baby as well. Bone deficits become more pronounced. So osteoporosis, more significant bone loss occurs the longer we have starvation. And even though we have some medications that could slow down bone loss and some medications that could bring in minerals to the bone, often the bone becomes more significantly impaired and sometimes it's not fully replaced the tissue. So that's something we want to be cautious of as well. We don't want someone young to develop osteoporosis. So those are some of the concerns with starvation. Let me just talk a little bit about purging. Purging is, by definition, when we compensate from a binge, but let's talk about purging. Purging could involve vomiting. Purging could involve using diuretics. Purging could involve using laxatives. There's other forms of purging as well, but the more common forms of purging involve us losing fluid, right? So if we vomit, what happens is that we're bringing up fluid. We bring up acid with the fluid because the stomach is a more acidic environment, but we're losing fluid. When we use diuretics, we're losing fluid. When we use medications that increase our bowel movements, laxatives, we're losing fluids. So what happens when we lose fluids? What does the brain and body do? So our hypothalamus, again, that regulatory part of the brain, senses that we're dehydrated, that we're losing fluids. So the hypothalamus sends a message to the kidneys. We have 2 kidneys in our body. These are organs that help us with deciding what we put in urine and what we keep in the blood. So the kidneys get a message from the hypothalamus when we are losing fluid, and the kidneys get this message, and the message says, hey, we have to retain fluid, don't put as much fluid into urine. How do the kidneys do that? Well, the kidneys, after getting a message from the hypothalamus, send a message to the adrenal glands. These are glands, these are organs around the kidney, and tell the adrenal glands that, hey, we're dehydrated. The adrenal glands release a hormone called aldosterone. And aldosterone is what we call an anti-diuretic hormone. Like diuresis means we lose fluids. This is an anti-loss of fluid hormone. So the aldosterone goes back to the kidneys, and the kidneys do this by sending a hormone called, there's this renin-angiotensin system from the hypothalamus to the kidneys. The adrenal gland gets this message from the kidneys, and the adrenal gland releases this hormone aldosterone. The aldosterone goes back to the kidneys and says, hey, let's not put water into urine, let's keep it reabsorbed to help us with dehydration. This is great because now we're getting water back into the blood because the kidneys are not making as much urine. But what happens with aldosterone is that potassium, which is a positively charged ion or particle in our blood, leaves the kidneys. As aldosterone brings in a water molecule, aldosterone will push out potassium. And so now all of a sudden we have more fluid, but we have low potassium levels. Potassium is one of many electrolytes, particles, that help the heart beat in an effective way. They help with normal electrical activity of the heart. So if we're losing potassium now, all of a sudden we get our heart electrical system potentially not functioning as well, and we still get the lub-dub, but sometimes now we'll get the lub-dub, lub-dub, dub-dub, lub. We won't get that succinct moving forward of blood, and that again could cause blood to get stuck in the heart, and then the blood could clot. That clot could go out the arterial system. That clot could go into our vertebral and carotid arteries and could cause the brain to die wherever that clot forms. This has happened with Terry Schiavo. There's a case in Florida years ago where this woman, I believe she was either a nurse or a psychologist, but anyway, this got national attention because she threw a blood clot into her brain, but it was above her breathing area, above the brainstem that allowed her to breathe. So she kept on breathing, but her cortex died. There is not electrical activity going on in her cortex. So her husband asked that they pull feeding tubes for her and just to let her die naturally. Her parents wanted her to stay alive, and so they fought to keep feeding her through feeding tubes, but she was brain dead. The Florida Supreme Court ruled that the husband was in the right as far as they could pull the feeding tube, and she eventually died. But this brought national attention to what happens with purging and the possibility of throwing a blood clot from low potassium. We believe Karen Carpenter died the same way, and I know I've experienced patients over the years that have died this way as well, which is very sad. It's so unfortunate because there's some things we could do to help, by replacing potassium and monitoring someone more closely. Potassium, again, is such an important element for the heart that if you have too much potassium, it could cause electrical concerns, and too little potassium could cause electrical concerns. With vomiting or losing fluids, we often get too little potassium. That's the main concern with purging. Other concerns with purging is that we're bringing acid from the stomach into the esophagus. The esophagus is normally an organ that does not have acid that runs through the esophagus. So when we're bringing acid up into the esophagus, the acid destroys the esophageal lining. And if this happens frequently, someone's at greater risk for developing esophageal cancer. There's a condition called Barrett's esophagitis, where anatomically someone's diaphragm, where the esophagus runs through the diaphragm into the stomach, is not working as well, and acid comes up the esophagus, and the person with Barrett's esophagitis has a higher incidence of esophageal cancer. So do patients that have chronic purging behavior through vomiting. Our teeth, our mouth is not used to an acid environment. So if we have more acid coming up into our mouth, what we do is we destroy the enamel around our tooth, around our teeth, and this causes our teeth to demineralize or to deteriorate, and we could get cavities. And so dentists will often pick up someone that's been more chronically vomiting. So that's another concern with purging behavior. Our pancreas, which is very important, producing not only insulin but different enzymes for digestion. Our pancreas often gets inflamed and irritated when we're vomiting too much. And sometimes, someone will get irritation in their parotid glands and salivary glands, and may get an inflammation of tissue where it could be of concern.